Do you ever operate on both eyes together for cataract surgery? Historically, cataract surgery was always performed on one eye at a time, and one waited in a patient with bilateral cataracts for the first eye to fully heal before operating on the second eye. As cataract surgery has become more and more sophisticated and is now essentially keyhole surgery through a tiny nick in the eye, first of all, we used to separate surgery by a month. So we do the second eye a month after the first eye, and then we reduced it to 2 weeks, and then we reduced it to a week. And now many surgeons, including myself, operate on both eyes at the same time in certain patients. Now, one would only do that in a patient whose eyes were otherwise healthy, who didn't have any other eye disease like glaucoma or diabetic retinopathy. But many patients find that a satisfactory solution. It's particularly helpful for patients who have a need to get back to driving quickly. They may be the only driver in the family, and so doing both eyes together will rehabilitate them quickly. It's also particularly useful for patients who've got thick spectacle lenses, because following a surgery, the first eye that's operated on will no longer need a spectacle lens for distance typically. So if the other eye needs a spectacle lens, it's very unbalancing for a patient. They won't be able to drive because they won't be able to judge distances, and if they're the sole driver in the family, the sooner that second eye can be operated on, the better. Now, as the results of surgery and the risk of infection is low and the complications are now low, approximately 20% of patients are choosing to have bilateral cataract surgery, which means that their rehabilitation back to driving, getting new reading glasses, and functioning is much, much quicker.